Welcome to our February meeting of the Inland Coalition on Aging. My name is Dr. Ben Howdige. I'm the founding board chair and facilitating today at the beginning of the meeting. I will be facilitating the beginning of the meeting here today. So thank you for joining us. On behalf of the board, want to welcome you. To our February meeting. We have some exciting presenters, guest speakers, and a few updates to provide to you. Before we begin, I just want to remind you that the Inland Coalition on Aging is here to promote the, so sorry, I lost my train of thought here. I was going to talk about the coalition first really quick. Just a reminder that we are a coalition made up of professionals that work in the field of aging, disability, and caregiver services. If you are one of those, or if you're not and you're interested in this topic, please consider joining the Inland Coalition on Aging. You can go to aging.org and sign up for free. We need is your contact information, and that will allow us to send you information on upcoming meetings, conferences, gatherings, and work groups, and all the work, the fantastic work, exciting work that we're doing in the Inland Empire. So I encourage you to join, register before the end of this meeting, inlandaging.org. If you type that in, it'll come up, Inland Coalition on Aging. So for the agenda for today is we are going to introduce some of our board members that we didn't get a chance to introduce last time. We're going to provide you with some key updates, key points from the last meeting, just so we can continue with those discussions today. We have a call to action from our guest from the California Department of Aging. Excited to see Dr. Tompkins here with us from the California Department of Aging. She's going to share with us a call to action, and then we're going to do some breakout rooms because we want you to be engaged and part of the discussion. So you get to participate actively with us and with the rest of the group here. We are going to provide some IE master plan for aging updates. We're going to talk a little bit about awareness and our next meeting. Our next meeting is also very exciting. We're going to have a presentation from the Advocacy Director of AARP California, Rafi Nazarians, is going to be here with us. So I'm very excited about that, to be working towards becoming an age-friendly community. So more to come on that. Feel free to put in the chat your name, organization. Also, if you have any questions, feel free to enter them in the chat. We will have some opportunity for questions. So thank you again for joining us. First on the agenda is I would like to introduce a few of our board members. As I mentioned, I am the board chair. We also have Secretary Anna Schwartz. She's the human resources person at Community Access Center, a disability advocacy organization in Riverside County. I'll let her introduce herself in just a bit. Our treasurer is Carmen Estrada. She's the executive director of Inland Caregiver Resource Center. Glenda Jackson, she is the Assistant Director of the San Bernardino County Department of Aging and Adult Services Public Guardian. And also Dr. Jennifer De La Rosa Ramirez is with the Riverside County Office on Aging. Okay, so I want to tell you a little bit about our last meeting. I want to catch you up to speed for those that were here and those that weren't here. I want to tell you a little bit about what we did last meeting, what we talked about. The ICA was formed back in 2008. Actually, it was previously named the Long-Term Service and Supports Coalition, long name. And so when we regrouped and started this coalition again to take up the work of the LTSS coalition, we renamed it the Inland Coalition on Aging. So we've been around for a while. We've just have a new leadership group here and a new name, a new website, but same focus of providing support and integrating care, and working towards a better Inland Empire for people with disabilities, seniors, older adults, and caregivers. The vision of the Inland Coalition on Aging is a community where older adults and people with disabilities and caregivers age well. Very simple, to the point, a community or an Inland Empire where older adults, adults with disabilities, and caregivers can age well. Our focus of the ICA right now is a very important project, and that is to create an Inland Empire Master Plan for Aging. We are basically following the steps of Governor Newsom's Master Plan for Aging, the California plan. We are creating one here for the Inland Empire that addresses the needs and priorities of our community, the Inland Empire. So we're very excited. Once we develop the master plan, it'll be a blueprint for you, for me, for elected officials, for hospitals and social service organizations, caregiver organizations, disability advocacy organizations that can take that blueprint and then work on projects that are going to continue to move the needle forward. Again, so we can have a community where older adults, adults with disabilities, and caregivers can age well. The last meeting, we reviewed the findings for the domains. The main domains that we're focusing on are caregiving, transportation, housing, healthcare, behavioral health and social support, Alzheimer's, and all other dementias. So this pretty much probably captures every one of you on the call today. I know many of you and have seen who's on the call and know that all of us have a connection to one of these or more services. I know I do. I can support every single one of these and every one of these subcommittees that we have. By the way, we have some subcommittees. Want to encourage you, if you're not part of one, to join. You can simply put it in the chat if you'd like to join a committee, or connect with us via email, and we'll be sure to connect you to some of the upcoming work group, work group meetings. Also invited everybody to join one of these caregiver groups, one of these groups, subgroups. And if you're interested in caregiver, Alzheimer's, and dementia work groups, we need some members there. We need some folks who are interested in transportation, behavioral health and support, work groups, and housing. In fact, the housing committee, I believe, meets tomorrow. I'm on that committee along with Tanya Turner with Riverside County Housing and Workforce Solutions. If you're interested in that, please join us. That'll be tomorrow. That is it for the updates, review of key points from yesterday. We do have a special guest today. I'm very excited to have Dr. Jackie Tompkins. She is project director of the Master Plan for Aging at the state level. She's with the Division of Policy, Research, and Equity. We invited her, obviously, because of her expertise with the subject matter here of the Master Plan for Aging. We're very excited to partner with her and continue promoting a master plan, not only the state level master plan, but also the local Inland Empire master plan. So I'm going to go ahead and give the mic over to Dr. Tompkins. Thank you again, Dr. Tompkins, for joining us today.
Pleasure to be here. As alluded to, my name is Jackie Tompkins. I serve as the project director for California's Master Plan for Aging at the Department of Aging. I have been in this role only about 2 months. However, I've been with the department for over a year, and I have worked extensively on helping our California Department of Aging, specifically our Master Plan for Aging, start to build local connections and build partnerships throughout the state. I am pleased that not only has Inland Empire been champions in the space of aging, disability, and caregiver services for numerous decades, I know that they were also able to receive funding from the SCAN Foundation and furthermore receive funding from the California Department of Aging to help further investments, planning, to lead to your own local master plan for aging. We acknowledge that while we definitely have our state's master plan for aging, that there is tremendous value and assets when communities are able to organize, think through their own strengths, think through their own assets and needs, and what they're hearing from community members and service providers on the needs to address California's aging population, those with disabilities, and family caregivers. So just so feeling incredibly blessed to be able to join all of you today and get to know a little bit more what's happening in Inland Empire. I'm going to spend a little bit of time just talking and providing some updates on California's Master Plan for Aging, and then also kind of looking ahead of what's in store for California's Master Plan. We are basically moving into year 4 of implementing California's Master Plan for Aging. It was originally launched in January of 2021, And so sharing on this slide that on an annual basis, we are required to provide a legislative annual report. And this annual report really is a way for us to continuously communicate out and highlight the successes and meaningful investments and changes that are happening across our state due to having a master plan for aging, a collective body of work that state agencies and departments are working towards to allow individuals to age where they choose and how they choose. And so if you weren't already familiar with this document, we did release California's third annual report in late January of last month. What I also want to share with you is California's Master Plan for Aging webpage also houses some additional resources that might be of interest. This includes a detailed spreadsheet of the budget investments that have been made at the state level to date since the initiation of the California's Master Plan for Aging. And we'll talk about that a little bit later. And then some of you might also want to be connected to what specific initiatives are the various state agencies and departments working towards. So on this webpage too, you'll be able to find what are our current 2023 to 2024 initiatives. So bookmark that for your future reference. Within California's Master Plan for Aging, we do have 5 bold goals. We look at housing, health, inclusion and equity, caregiving, and affordability. So on this slide, I just want to highlight from the goal level of California's Master Plan for Aging, there have been significant highlights in each of these goal areas. While CDA, the California Department of Aging, is the convener of California's master plan, it really takes the collection and the whole of government approach to achieve these goals. When we talk about transportation, housing, and healthcare, we must work with our Department of Healthcare Services partners, Department of Rehabilitation partners, social service partners. And I imagine this collection of partnerships is something that you're also experiencing in Inland Empire as well. So just kind of related to housing for all ages and stages, there has been advancement in helping to build the capacity for housing services and preventing homelessness within California. This includes the Department of Social Services Community Care Expansion Program. And additionally, this past fall, the California Department of Aging did convene leaders across the state to specifically talk about preventing and ending older adult homelessness. Related to Goal 2, there's been significant advancements in helping to expand healthcare affordability and access within our state, and also investing in Alzheimer's early interventions. I'm seeing that a lot of our goals within the state level also are the goals that you have outlined or some of the findings you found for your Inland Empire from those Inland Empire needs assessments as well. And so I love to see that parallel structure happening at the state level as well as the local level. Goal 3, which really focuses on inclusion and equity, the California Department of Aging was awarded $50 million to support older adult behavioral health. And within this bucket area, we are working towards supporting the Friendship Line, building out community grant RFA, as well as building out an awareness campaign for older adult behavioral health. We also acknowledge the importance of caregiving, whether that's the direct care workforce or even family caregivers. I'm a family caregiver myself for a son who has a developmental disability, and so I understand firsthand the challenges and the blessings of being a family caregiver, and also the needs to have resources and supports in place so you can build confidence in the care that you're providing. And so there's been investments at the state level to support our in-home support services workers, as well as our Cal Grows program with our direct care workforce. And then finally, being able to also expand the affordability of living and aging. And some examples of this that have happened at the state level are some record investments related to senior nutrition by expanding CalFresh eligibility. We have these 5 goals within California's Master Plan for Aging, but we also have 23 strategies and initiatives that help support these goals. And so on the next slide, I just want to walk through very quickly, because I know my time is limited, on just some highlights of some initiatives that are taking place. So California has embarked on a survey to understand and study the needs of California's LGBTQIA plus community. Some of you might be already familiar and connected to this survey. It was launched in early January. There was an article actually in the San Francisco Chronicle recently about this survey, and it's actually getting some national attention. This survey is going to close at the end of March, so please continue to disseminate the information to your counterparts and networks. Also, we are looking at enhancing California's AAA structure to, again, meet the changing needs of California's population. And this initiative is named California 2030. If you're not already familiar with this particular initiative, there was a core set of recommendations from this initiative to help structure California's AAA system. And this has also been identified at the state level within our own Agency of Health and Human Services to be a priority project. We are also in the realm of housing. California is looking to address the housing needs of older adults and people with disabilities. And California was just awarded an opportunity to work with our federal partners on a technical assistance collaboration in which we're going to be able to work not only within CDA, but our other state partners to receive technical assistance from those federal partners on how to strengthen partners. How do we enhance and leverage existing federal waivers? And then we also are working on California's no wrong door system. We acknowledge that we could have a variety of resources and supports in place, but if people can't find and access these resources, that can be very, very challenging. And so California's No Wrong Door State Leadership Council is starting to convene next month to develop this system. I talked about how the navigation of services within the structure of long-term services and supports is one component of systems change. However, we are also looking at this issue of long-term services and support systems change from a multifaceted approach, where we need to ensure that people can navigate correctly to the resources they need, they have access to the programs they need, there's a workforce that can support it, as well as looking how do we afford as a state the systems change that needs to occur. So this is just to illustrate when we talk about topic areas or issues within our state, a lot of times there's definitely not a single strategy or approach that we're looking at it towards, but rather we are looking at it from multiple angles and with multiple partners and systems to create that larger systems change. I talked about briefly that California has, since the inception of California's Master Plan for Aging, there have been $9.5 billion in investments made to support older adults, people with disabilities, and caregivers. And as shared, we do have a spreadsheet on our webpage organized by California's Master Plan for Aging goal areas that articulates these investments and where they are housed in terms of which state agency, which state department. So that is just wanted to elevate that the California's Master Plan for Aging is producing results. If you're not familiar with it, we also track the various initiatives within our Master Plan for Aging. We do have an implementation tracker where you can specifically identify housing as an issue, transportation as an issue, and see what the state is doing relative to the Master Plan for Aging initiative that's defined, and get updates on the current status of that particular initiative. Want to elevate it as a resource. It's publicly available. So wanted to, again, highlight it based on recognizing there's a diverse audience on today's call. And a couple more slides for me. California's Master Plan for Aging is also driven by stakeholders. We have a number of MPA stakeholder committees. Some of you might be on these stakeholder committees that help inform not only the development of the initiatives that move forward in the master plan, but also help with the implementation and how that looks moving forward. So we do update our MPA statewide initiatives every 2 years. So this fall, we'll be convening these MPA stakeholder committees who focus on equity, Alzheimer's disease and related disorders, elder and disability justice, as well as integrated living. We're going to be bringing together these stakeholder committees in addition to other state level partners and the public to attend an event in which they'll be able to share recommendations in the space of aging, caregiving, people with disabilities, that we can consider for the next set of MPA initiatives moving into 2025, 2026. And in closing, this might be familiar to all of you, but I just wanted to acknowledge that your particular area of the state is growing exponentially as it relates to our older adult population. So I want to, again, thank you and commend you for the work that you're doing in your respective area, because you are listening to your community members and you are taking those findings and turning them into recommendations to move forward in those areas that were discussed earlier. So wanted to highlight that and also acknowledge that your area is part of a broader network of cities and counties across our state who are looking to develop their own master plans for aging at the local level. So this cohort and this group of, we call it LADAP, are really leading the way in this space and are going to be the leaders not only within our state, but again, there is a national attention on how do we develop local plans. There's other states just starting to broach the idea of developing state plans, but I have outreach to other states who are like, wait, what, we can also do local plans, and what has that looked like in our state? So I just want to extend my thank you and gratitude to the work that you're doing at the local level to help advance California's master plan for aging. So I'll close it with that. I'll put my contact information if you're interested in connecting with me or my team. But I do want to thank Carmen and the members of the coalition for inviting me to speak and share about California's master plan for aging. And I encourage you to join one of those work groups and really stay connected to the work that's happening in Inland Empire. It's being acknowledged, it's being recognized, and look forward to all the great outcomes from your endeavors.
Thank you, Dr. Tompkins. Very exciting work being done at the state level. And as you said, here at the local Inland Empire, this is unprecedented. The level of collaboration, the level of funding, the level of work being done by organizations that have a shared a vision is just phenomenal. I've been in the field for many years, and I don't think I've seen the level of work being done that it is now. So thank you for bringing the message from the California Department of Aging. We thank you for the partnership also. Thank you for attending today. Appreciate that.
Absolutely. Thank you.
I'm going to turn it over to Carmen Estrada, who's going to tell us a little bit about the break rooms. Carmen.
Hi, everyone. Thanks again to Jackie for joining us. A lot of great information. And, the reason that we asked her to present today to all of you was to show you, obviously, that what the state is working on, but also how what the work we're doing here is a part of something even bigger, right? And we should definitely be proud to be a part of that. And so we want to encourage you to participate in our work groups, to continue attending our ICA meetings, to continue helping us shape the master plan for aging, as well as to continue to enhance our Inland Coalition on Aging. And so, thinking of collaboration and working together, we polled everyone last meeting, and we wanted to know, how can we make these meetings better for you, right? These meetings are for you. And so one of the requests was more, participation and discussion amongst one another. And so we've created these breakout rooms that we're now going to be having you participate in. We've created these 4 questions based on the recommendations that have come up that we've gathered through the IEMPA, as well as to help guide the coalition. And so these are the 4 questions we've created. And so the first question is, under education and awareness. And so this ties into what Jackie had talked about, a wraparound model, right? That we're trying to create, because A lot of times we find agencies working in silos. And one of the things that we did find within, doing the focus groups and the listening sessions is the lack of education and awareness about the resources that are already out there. So an overarching theme we found for all the domains and recommendations was communities have a lack of awareness of resources. What can we as a coalition do to improve education and awareness in the community? So that's question one. Question two is, agencies working in silos contributes to client burnout when searching for resources and accessing services. What can we do as a coalition to improve collaboration between agencies? Then we came up with these two questions specifically related to the IEMPA. The first one, the IEMPA, so this is our own master plan for aging, is going to address the unique challenges of aging in the Inland Empire. There are a wide range of needs amongst older adults, adults with disabilities, and caregivers. What can we do as a coalition to make sure that the IEMPA is age and disability friendly? And then finally, what can we do as a coalition to make sure the IEMPA aligns with the cultural needs and values of our diverse community in the Inland Empire? We're going to break you out now. And so please, if you can, type your collective response from your group, answer to the question that was asked in the chat. What we're going to do is we're going to collect the responses. We're going to share them with our Inland Coalition on Aging board, since some of the questions had to do with how we as a coalition, what we as a coalition can do. And then we're also going to share them with our work groups to help guide them as they work through narrowing down the recommendations. And we did have actually a few emails come in during the meeting of individuals that are interested in participating in the work groups. And so once again, if you are interested in participating in the work groups, email us at info@inlandaging.org. That's how you're able to participate in the work groups. You can get connected. Again, thank you for participating in the breakout sessions. And we're going to continue to have these types of breakout rooms in the following meetings. So please, again, whoever you chose to type in your collective response, type it in now before the end of the meeting. I will be turning it over to Janelle Dahl, who is a special projects manager for Finest City Entertainment, and she's helping us with our awareness campaign. So in addition to working through the recommendations to put together our master plan for aging, we also want to create awareness in the community about the work that we're doing. We want to get the community involved. So Janelle is going to talk about how we've been doing that so far and how you all can help us continue to do that. Janelle, are you available?
Yeah, I am. Alrighty. Hi, everybody. My name is Janelle Dahl. I work at Finest City Entertainment. As Carmen said, we're supporting the design and marketing for this project. I'm going to move relatively quickly in the interest of time. I know we're running a little bit behind here. So just from a process perspective, our team has been working with Carmen and Ben to brand the Inland Coalition on Aging. As Ben said, the name was visited when this project took off last year. So with that rebrand, we also then designed a handful of assets, which I'll go over, with the goal of bringing awareness to both the coalition and the IEMPA project. So we are really focused on creating content and visuals that will resonate both with the local community as well as with industry professionals such as you all. So we started with the website. The website is available at inlandaging.org, and there's primarily two goals with the website. One is for people to learn who the Inland Coalition on Aging is, and the second is to learn about the IEMPA project. And with those goals, we have two conversions, right? People can either sign up to join the coalition if they're an industry professional, or if they're a part of the public or they just want to learn more about the project, they can sign up for updates. Through marketing assets, we've also created a handful of things. I'll show some of them in this deck. We've created a one-page flyer, which could be used digitally, and a tri-fold brochure, which can be used in print. We have a social media toolkit, and we have an informational video about the project as well. Most of that is available on the website. We don't have the social media toolkit on the website, but that is something that can be shared with you all to support with helping build awareness about this project and helping with the outreach to get more people involved in the master plan for aging. So here's the digital brochure, the one pager, and then here's the front of the trifold brochure. Again, these are available on the website. I'll show that page in just a moment. And they are intended for your use to be able to, again, spread awareness about this project and help us to build more community support. In the interest of time, I won't go through this whole slide deck here, but here are some screenshots of the different social media assets that have been created. There's a full social media toolkit with dozens of posts related to awareness around why a master plan for aging in the Inland Empire should exist, the different goals or the focus areas of the master plan for aging. There's captions and multiple visuals to select from, all very easy for you to just copy and paste. And then again, I won't play back this video, but there's a 3-minute informational video about the master plan for aging, about the project, and then about the coalition as well. This is available on YouTube right now, but it'll be available on the website later this week. So what's coming next? We'll be creating all that information in Spanish. So that informational video is being produced in Spanish right now. Those marketing assets, the one-page flyer and the trifold will be available in Spanish. We're also translating the whole website to Spanish. So all of those assets will be available for our Spanish-speaking community as well. And then we're additionally supporting with some regular email updates to the people who have subscribed for those updates. And again, we are here to provide assets for you. So as requested, we can produce additional assets as well. We'll be creating infographics. We can create more content, whatever you all think would be helpful to have to support that outreach and community support. So we really do encourage you to share these wherever is appropriate on your platforms, whether that's on your organization's website, on your organization's social media, on your own LinkedIn to share it with your network that you're a part of this project, and also having those printed materials. In our breakout room, we were talking about the importance of meeting people where they are and knowing that not everybody is going to be engaging in digital content, using those printed materials to connect with people in the spaces where they're already going, right? So if that's doctors' offices or other types of settings in which the people who we want to learn about this project are already going, that's a great way to leverage those printed materials. And again, goals of sharing these assets are to increase awareness about the coalition and the fact that there is an Inland Empire Master Plan for Aging being developed, to build community support and to get support from leaders who are going to really be crucial when we go to implement the Master Plan for Aging once it's complete. So I ran through that super quickly so that we could leave time for questions. And I know there's also other agenda items to get through to today. I'll share this deck with Carmen so that she can share it with you all. And we'll make sure that you have access to all of those assets, the trifold, the brochure, the video, the social media toolkit, all of that will be available to you. And I'll include my contact information there as well if any other questions have come up. But I think we have about 1 minute left if anyone has questions related to this. Or Carmen, if there's anything else you'd like me to speak to.
Yeah, we have a few minutes left. So if you wanted to share the 3-minute video.
Do you live in the Inland Empire? Exciting news! The Inland Coalition on Aging is putting together a master plan for aging just for our community. In the next 20 years, the number of people in California over 65 will almost double. Those aged over 85 are growing the fastest. In our local region, we will experience an over 200% increase in the population of individuals over age 60 and a 600 to 700% increase in adults over age 85. These growth rates are higher than the state averages. This means the Inland Empire is aging at a rapid pace, which will lead to an increased demand for health and support services for older adults, adults with disabilities, and caregivers. A master plan for aging helps us get ready for these changes. The Inland Empire Master Plan for Aging will address the unique experience of aging in a geographically diverse region, considering the challenges in both rural and urban populations in San Bernardino and Riverside counties. The Inland Empire Master Plan for Aging will include an action plan focused on optimizing health and wellness of older adults, adults with disabilities, and caregivers. This includes considerations for housing, transportation, healthcare, behavioral health and social support, Alzheimer's, and all other dementias, and caregiving. The plan is developed in response to community input gathered through focus groups that reflect diverse geographic locations and subgroups, and informed by local aging services providers. Wondering who is working on this plan? Meet the Inland Coalition on Aging's IEMPA Advisory Committee, a group of professionals serving older adults, adults with disabilities, and caregivers. The committee is co-led by the Community Access Center, CAC, and Inland Caregiver Resource Center, ICRC. It also includes representatives from San Bernardino and Riverside counties, Inland Empire Health Plan, and the Alzheimer's Association. This project is being supported by the SCAN Foundation and the California Department of Aging. We welcome you to join us in the process of developing the Inland Empire Master Plan for Aging. If you are a professional working with older adults, adults with disabilities, and/or caregivers, join our coalition to provide direct input on the plan's development. The general public will also be asked to provide feedback and input on the plan. To stay informed of our progress, please visit inlandaging.org. As our population continues to age, we know that we must thoughtfully plan to provide services and support. Join us in creating a more sustainable infrastructure for our aging community.
Right. Thanks, Janelle, for sharing that. And so like Janelle said, these assets are going to be available for all of you to share at inlandaging.org. We want your help in spreading the word. So sharing the video, sharing the posts. She's going to be posting a social media toolkit. I'm going to be posting in my LinkedIn, and we want all of you also to post and share so that we can continue to gather feedback and continue to make our community aware that this is happening, because it's important. That number that keeps sticking in my head is like 607% increase in individuals 85 and older in our community. It's the highest across the state here in the Inland Empire. So we need to, be prepared, and we need to work together to make a master plan for aging that is going to be reflective of our needs here in the Inland Empire. So with that, we have 3 minutes left. Our next meeting is March 26th from 11 to 12 again. And we are going to be having a presentation from Rafi Nazarians, who is an advocacy director at AARP. And he is going to be sharing about how to become and why it's important to become an age-friendly community, which is something that we're working on also here in the Inland Empire, is making our Inland Empire, both Riverside and San Bernardino counties, age-friendly. Okay. So again, thank you all for joining. We do have a post survey. We want you to let us know how we're doing. And so we want your feedback. How did we do today? Could we do better? What other suggestions do you have with future meetings? These meetings are for all of you. So we don't want to just be, putting together meetings and wasting your time. We want you to be involved. So let us know, give us some feedback on how we can make these meetings even better in the months to come. And so thank you again for joining. Ben, did you want to say anything
I just wanted to thank you, Carmen, and that video was amazing. Please share it with everybody. The video is in the chat. We will send you the link afterwards along with the presentation. Please share it widely. And don't forget to join the coalition by going to our inlandaging.org website and join as a member so you can continue to get updates about upcoming meetings and activities. We'll see you next time on March 26th. Thank you, everyone.